Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics, and of course, where we do encourage you to call in to join in. Folks, it's been, I don't know, I have to take a look exactly, well over a year since I've come back to this topic. I do it every once in a while. Your interest always peaks when I do, and well, there's a real reason to do it now because the list has changed. The list I'm talking about are now the 10, count them up, 10 cardiovascular inflammation risk factors that we have utilized in this practice for a long period of time. Now, you out there who listen to the show oftentimes like to listen along with us and manage your own healthcare issues. Of course, if you come to this office and are managed by me, these kinds of laboratory analyses are already being done. But if you're out there and you're trying to manage them on your own, you at least better have a list. The list is now 10. I encourage you to go get a piece of paper and a pencil and write them down, and you can discuss them with your doctor. Well, we'll see what I mean by that in a moment. You can discuss them with your doctor and ask him if he might like to order those lab tests for you, because they truly do spell out your cardiovascular risk issues. So, that'll be after our first break today. Much more coming up in that regard, but the first time we've ever done the full 10, because the list is now 10. The up and comings on Wednesday, scintillating topic. I think try to take great care in writing out how I'm going to phrase this topic. But here it comes. I've been doing a lot of reading and research, and I've been prompted to investigate the issue of cancer, and I'm ready to make a statement. And on Wednesday, I'm going to do just that. You'll want to stay tuned because, as it turns out with respect to cancers, there's only, as the investigation has now shown, there's only one possible way that you could ever get a cancer, and there's only one possible way that you can avoid it. Now, I know that's a titillating discussion. I know you want to listen to it, but I truly mean what I say, and I think that the investigation has now shown that which seems to be really mired in muck and misunderstanding about this very fearful issue that all of us seem to have, but nonetheless, there is a way to control this issue, and I'd like to discuss it with you on Wednesday. So that'll be the topic. It's another one that we'll be taking some time with to let you pick my brain a bit. Then on Friday, we're going to open it up to you. You'll probably have enough to discuss with the two teaching sessions I guess we're going to be having this week. The classroom on the air is underway starting today. And Friday, we'll open them up to allow you to come on in and sort of set the agenda as you see it. Now, as we move into the next week, things start happening, folks. Things start popping. Doug Inglesby will be with us on Monday the 15th, discussing how low-cal diets are driving you crazy, and they are. On the 17th, Lonnie Birmingham's going to be here talking about, we're getting a cool-off now. We could have used her a month ago, right? Talking about heat, the number one killer of all weather hazards, and the issue of the unbearable heat that we have had in Pittsburgh and the rest of the eastern seaboard countries, eastern seaboard states, has been interesting this year, has it not? Anyway, Lonnie will be with us on Wednesday the 17th. On the 22nd, Roland will be back. We're going to be talking about BAC, a very interesting way to present and handle your supplement issues. BAC stands for Bioengineered Algae Concentrates, the unique product formulated by a Soviet scientist that you actually met on our radio show 2 months ago. His name is Dr. Michael Kiriak. Anyway, he has really done us a great service by bringing us a form of supplementation that sort of one does it all. It's called BAC, Bioengineered Algae Concentrates. And I think that phrase says it all, because these are absolutely engineered by him. These algae are grown, 4 of them, grown in the Siberia area of Russia. Still today, they're grown in hydroponic ponds. They are organic, and they are supercharged with nutrients. Any one you want to name is found in this stuff, and because it's a plant and it's a natural organic product, it is fully assimilable, and that is a difficult thing to be able to assure yourself of when taking supplements. I see them in the jar. I can read the label. The label saying there's a lot of stuff in there, but whether that ever gets into that bloodstream of yours is a completely different matter. Anyway, Roland Thomas talking about the F3 version, which is the most potent of the 3 products made by BioAge, the name of the company, that was formulated by Michael Kiriak and Roland Thomas. Roland will be our guest on the 22nd. Hope you enjoy him. Now, when we get to the 25th of the month, not that it's a Thursday, folks. We don't even do shows on Thursday, but I tell you, we have now resumed. The gun has been fired, and we are now resuming MCG testing in a big way around here. The actual device is now procured. We have it available to us at all times, and we are starting to plot through the many people who were tested via the MCG approach as far back as February. That's when we first introduced it. MCG, should you never have heard about it before, stands for Multifunctional Cardiogram. It's a very unique device. It's a unique device because, well, it's very difficult to find these kind of tests in the western Pennsylvania area. Other states have had more fully developed programs. We're just at the infancy stage, and we were right literally at the birth of MCG testing, bringing it to you. You responded. You felt that you would like to be tested in this way. It is insurance covered after all, and to be able to find out, and here's the key, the punchline, the reason why I think it's so important, it's able and possible for you to know what the status of your coronary arteries are. A pretty important set of real estate there that's serviced by those arteries called the heart. What the status of your coronary arteries are, as though you had a cardiac catheterization without ever having a cardiac catheterization. Who ever wants one of those? Anyway, to find out what the status of those blood vessels are, how much occlusion of those arteries is present, is a precious statistic that everybody should want to know in order to either set their mind at ease or have at it with respect to correcting it. MCG testing affords us this. We resume the testing on the 25th. By the way, I mentioned to you today, you can't get involved with the one on the 25th. It's already closed. It filled up rather quickly. But I'll give you the second date, folks, because there are plenty of spots available for September 8th. If you have had previous MCG testing and you were told that you should repeat within 3 or 6 months, both of those dates are up. Give us a call. Your retesting is assured now that the device is available. But those of you who have never tested at all and think you might like to know this information, you give us a call too. The number, do it right after about the night when we go off the air. Office sort of starts running around here. You want to talk to Kim, the office manager, at 724-942-3002 to be able to sign up for the 8th. The 25th of August is filled. The 8th is filling, and of course there'll be future dates. We'll try to do them at least another one in September, and then at least monthly after that, to allow all of you out there to take advantage of what I think is the finest, newest, most space-age, new-age electronic device, now with a medical application heretofore not possible just in a simple way, lying on a bed, and in 6 minutes have with two clips around the ankles, the wrists, and one lead off the left side of the chest, be able to sweep, electrically sweep, in sort of an EKG fashion, completely benign, no ruffles, no frills, and when it's over, this information is then compared to a database of 42,000 plus patients who have had CAS as well as this test, and that those data points are able to be assessed. 166 of them. I don't know how it does it. Who needs to know how? It's just, it does do it, and we can benefit from having it done. MCG testing now fully entrenched here at the office. Also, too, speaking of products, I already mentioned the F3. We absolutely want to keep mentioning to you because as even Wednesday and Friday roll around, the issue of the importance of replacing fatty acids in the appropriate form and the appropriate amounts is going to become a staple item here, as well as I hope in your own mind, in your own supplementation, in terms of replacing those fatty acids. We now know, or at least I've said it loud enough, fish oils are hazardous to your health. Not maybe hazardous, they are hazardous to your health, especially if they've been taken for any length of time. Go back to the shows of last week or the week before if you need to hear repeats on how that statement can be made, if today is a little perplexing to you. But nonetheless, there's one product that will shine through as the unique offering to be able to replace those fatty acids. It's not fish oils any longer. Way too much EPA and DHA, folks. Way too much. And now it's a replacement of 4-to-1 ratio of omega-6. It's the balance. Omega-6 to omega-3s. The ratio is 4-to-1. You need much more omega-6 than you do omega-3s. This ratio is the replacement ratio. This is the way that they're found in the body, and they have to be the parent compounds, meaning the lowest on the ladder. And the lowest on the ladder is called either, in the case of omega-6s, linoleic acid. The most representative parent compound of linoleic acid happens to be known as sunflower oil or primrose oil. These seeds are able to produce this particular product. And then on the omega-3 side, alpha-linolenic acid. I get that confused all the time. Alpha-linolenic acid, the parent compound representing that omega-3 product is flaxseed oil. Very potent omega-3, and for that reason, the ratio needs to be tilted toward the omega-6s. 4-to-1. The product we have here, we can't keep it in stock enough. It's flying off the shelves. If you want us to send you out some, give us a call. It's made by Body Bio, the owner and CEO of which has been on our show, Ed Kane. And this product has been produced since 1995. Why, you say? Do I know that it was produced since 1995? Well, they found out in 1994 that through the work of a Dr. Yehuda, a Israeli scientist, that ratio of 4-to-1 is what was scientifically appropriate, and they went into production immediately. And as far as I know, they're the only production line in the entire United States, for that matter, the world, that continues to offer this in its right form. Anyway, much more about that as time moves on. Other up-and-coming guests looking into the month of September. Of course, you know, Dr. Boom, Susan Smith-Jones will be returning on the 7th. And our good friend, David Brownstein, returns to us way out into the future. It's 16th of September. But he'll be talking about salting your way to health. This is a conversation we just initiated last month. The month of August was pretty much closed off to us because he was spending some good family time, getting his vacations out of the way. He'll be back and reporting for duty here on the 16th, and that's pretty much the way things are going to go around here. Now, let's do this. Let's take a short break. In the interim, you go run and get that pencil and paper. Have it ready. I'm going to go through that list. We'll talk about the list. It's a unique list now, first time we've ever done the 10-component list. I'll tell you more about that when we return. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith, let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impacts on Your Health. Here in a Monday morning version of the show. This week is pretty much open. We'll be spending some real quality time together, you and I, this week. And we're going to kick it off with, in one way, a very old topic, but in another way, an absolutely new topic. This issue of inflammation risk factors. Let me put it in its proper context, folks. Cardiovascular disease, which has been an area of real immersion from my perspective as a doctor since 1995. I think it was my entrance. It was what provoked me to enter the alternative realm of approaching the treatment of disease from a completely different aspect than my medical training had ever offered me. And it all centered around the cardiovascular issue. And so from that time forward, we've got very sophisticated here. I think, bar none, we're the most sophisticated as one could be, as I see it, throughout the entire world. There's no better way of assessing the cardiovascular issue than we have been pursuing for quite some time now. It's going on 15 or 16 years. So as one of the outgrowths of that, we always discussed and have discussed for years now, inflammation risk factors. Now, I'm going to allow the caller to come on in the store, ask a quick question. I'll get back to it in a moment. Folks, you get that paper and pencil, get ready to roll, because we're going to go through the list of 10 before this morning is up. Come on, the store. You've got the show. It's in your control. What's on your mind? Hello.
Yes, sir, doctor.
Yes.
Could you tell me maybe mention a little bit about creatine for kidneys?
Creatinine.
Creatinine, I'm sorry, yes.
Creatinine. This is you're talking about a blood test, a test.
Yes, sir. Yes.
That is obtained through what's called now, it has gone under many different titles before, but in medicine it's called a metabolic panel. Has multiple components. There's 16 to 20 different components. One of the 16 to 20 different tests is creatinine. And this is a very sensitive measurement that reflects the health and status of your kidneys. Creatinine is a byproduct of the degradation of muscle. And it is cleared in only one part of the body. It's cleared by the kidneys, okay? So as long as the kidneys are working well, as muscle degrades, and it does degrade each and every day, and you need to eliminate that degradation, the kidneys are responsible with doing it. And as long as they are doing their job, meaning the kidneys, your level of creatinine should normally be at 1.0. By the way, do you happen to know you...
Hers was 1.3, doctor.
All right, so 1.0, and by the way, there's an error, plus or minus a 0.2. So a person who has a 1.0 could have a creatinine as high as 1.2 or as low as 0.8. That's a built-in fudge factor, right? Now, why is this thing so good at assessing kidneys? Well, we in medicine follow the rule of doubles. If a creatinine level has ascended to a level of 2.0, then what it means is, and this is why doctors have relied on it for years, what it means is that you've lost 50% of your kidney function.
Wow.
If you have a creatinine of 3.0, you've lost 66% of your kidney function.
Wow.
And so as people move from 1 to 2 to 3, and some have kidneys that are afflicted by all sorts of problems, you move closer and closer to dialysis, which usually is hallmarked at around a creatinine of 4 to 5. And at that point, you'll either need to be doing, if the disease process has moved that far now, you'll need to be doing either peritoneal dialysis or hemodialysis in order to flush the waste products out of the body. So that's my 50-cent answer to you today. I hope that clarifies it. At 1.2, you need to be looking at a number of these creatinines because that could be a fudge factor error. But if it, over time, comes back 1.2, 1.2, 1.2, always, then it's showing there is a kidney dysfunction and disorder going on that has to be identified and rectified. Otherwise, what is 1.2 today can and could become 1.4 tomorrow and start you on that pathway that you do not want to pursue, okay?
Well, the doctor said, doctor, that her one kidney, which has a 1.3, is sluggish, but it's still functioning.
Oh, yeah. There's people that can have completely lost one kidney, actually have donated a kidney in 10 cases, and only have one kidney functioning, and their creatinine levels are 1.0. The one kidney can handle the job quite well. But it's a certain disease process. I'll tell you the number one process that causes kidney disease to advance. That's diabetes. Is your wife a diabetic?
No, sir. No, she's 7 years old, sir.
She's what?
She's 7 years old right now.
7?
And that affects the heart as well.
Did you say 7 years old?
7-0.
Oh, 70. Okay. And has she? So the number two cause of advancing creatinine levels is a hypertension. Does she have high blood pressure?
She did have high blood pressure. And
yeah.
The doctor was saying we could not get it down that fast because her kidney was sluggish and it wasn't producing.
All right.
It was affecting the high blood pressure.
All right. At least we found the initiator. Yeah, hypertension is the number two cause. So I'm
right here. Is there any way, sir, that she could take something to bring this?
Absolutely. You better come in to see me. You absolutely. I will tell you. I've taken a lot of pride in this. Is at 1.2, this should be easily reversible. Now, you come on in here so we can talk about how to do that. But I'm quite used to seeing patients who have creatinine levels well into the 2s and sometimes into the 3s. Well, we'll always get improvements. But I can say I've seen creatinines that high that we were able to get to 1.0, and the medical profession doesn't have a clue about how to do it.
Well, I'm going to be calling in for that fatty acid at 4 to 1. Would that help this kidney as well?
Oh, we have to do other things much more aggressive than that. Please call in, set a time to see me, bring your wife in, and we'll discuss it. Fair enough, sir?
Very good. I appreciate your help. You take care.
Absolutely.
Thank you, sir.
Hope you all benefited from that discussion, ladies and gentlemen. It is a very sensitive blood test. We are talking about blood tests today, so in a sense, we're not too far off the mark. But we're going to be talking about these inflammation risk factors. if cardiovascular disease, and this sets the stage really for the list of 10 now. Cardiovascular disease has been and continues to be the #1 killer. It claims the most lives each and every year, and when you bring in the second killer, cancer, we're now talking about there's two things and two things only that will end your lifespan on this earth, that 90% of the deaths each year are due to one of two things. When you leave this good earth, one of the other is going to claim you. Either you're going to have a cardiovascular event or you're going to have a cancer. On the cardiovascular side, which is one of the reasons why it was sort of my curtain call back in the mid-90s, because I knew it was such a terrible disease, the deposition of plaque inside the lining of an artery is the milieu. It is the process by which you ultimately lead to the major event that could be a lethal one, this plaque deposition process. We were talking about MCG testing to try to determine what the plaque amount might be in the coronary arteries, but it's equally as troubling and problematic if it's in the blood vessels that go to the brain or to the kidney or to any organ. An abrupt loss of blood flow to any of those is initiated at least by the deposition of plaque within the lining of arteries. Now, you may not know this, but I'm going to let you in on a little bit of a rule, that for plaque to form at all, and by the way, if you are on high blood pressure medicine, don't think you can sit back and say, geez, I wonder if I have any plaque. Because I can tell you, if you're on a blood pressure medicine, you for sure absolutely have plaque within those blood vessels, because that is the cause. That's why you lose the elasticity of the blood vessel once enough of that plaque does begin to accumulate. But the rule that most of the public is unaware of is that you cannot have plaque become deposited within the lining of any artery unless there is major damage or injury done to that artery over time. So a nice, pink, and elastic, and pristine artery that we come into this world with gets assaulted by a whole host of things and ultimately causes inflammation, first, of the lining of arteries, which is allowing the artery itself to become wounded and damaged, and only after an artery has been damaged can plaque begin to form. So you now see the groundwork being laid for why whatever it is that can cause an inflammation of the lining of an artery becomes a very important parameter to learn about yourself, so as to know if you have a problem with those factors, and if you do, you better try, you better have a plan, you better put something into play to lower that parameter. Now, there happen to be, as it stands right now, and this is the first time I've ever done the list of 10, because if you can remember, the list was 8. The last time I did this full discussion with you about the list of 8, I'm going to say was at least a year and a half or two ago. But now time has passed, time has moved on, and the list has increased. We now know 2 new blood tests that we didn't have before, and so this is the first time in all of the shows that we've ever done, the first time we're ever doing the list of the 10 inflammation risk factors. You need to know them. By knowing them, you are empowered with the ability to change them and to improve them and to put the fire out. Once the fire is out, then further accumulation of plaque within the lining of those blood vessels goes to nil, and you can then back it up, remove that plaque, and be far ahead of the game in terms of your cardiovascular risk. So, one point of emphasis I'd like to make before I actually plow into the list is this, that I did not, as you could well appreciate and understand, I did not invent this list. I am not that smart. Medical science has discovered these 10 parameters, and everyone in the doctor world, that includes your doctor, knows about every one of these 10 risk factors. They know about them. They also know, because they're very smart people, how injurious any one or combinations of them can be to your cardiovascular well-being. Yet, the cold, hard truth in this matter is that they may know of them, and they do, and they may know how harmful that any one of these lab tests or lab parameters can be with respect to your cardiovascular health. But as they approach you, and as they deal with you, and as they test you, they only ever order, and this is a very embarrassing thing to be able to say, but they only ever order one of the 10 lab tests. They only order one. They do not order any of the other 9. And that, I believe, is the real blemish. And for a person listening to me on the radio, you've got to be awfully surprised and say, how can that be? Why, my doctor is the greatest. He's the greatest thing since sliced bread. He was always thinking of my best medical interest. But let me tell you this. The reason why he only orders one of the 10 lab tests is that at the present time, he or she only has the ability, by virtue of using a medicine, to correct only one of the 10. At the present time, there are no medicines to correct the remaining 9. And until he or she actually gets a medicine that they can prescribe for you to fix the other 9, any one of which of the other 9, until there's a medicine to do that, he won't be ordering them anytime soon. It's my prediction. It becomes a little difficult for a doctor, even though he knows how injurious these parameters can be. Any one of these lab tests, reflecting that if it's elevated, if it's too high, it would indicate that this would be one of your inflammers, one of the things that's causing heat and irritation to the lining of arteries. You want to put that fire out. Well, to him, he's only able to put one fire out from his perspective. He can't, at this time, put the other 9 out. Therefore, he does not order them, and that's a very shocking thing to hear. We order all 10 here because there may not be a medicine to put out all 10, but there sure is a vitamin, mineral, herb, or other substance that will do just that, and that's why it's such a powerful thing to be able to intervene in these labs where there's a problem that's detected, being able to allow a treatment plan to lead to the full correction of that parameter is a wonderful thing to be able to do for patients. We enjoy doing it around here. And if you ever become one of my patients, you'll find that each and every patient does get this testing done. Now, many of you out there manage your own medical issues. I often have heard patients ask me, look, could you just write down these blood tests? I'd sure like to take it to my doctor and allow my doctor to order, because I have great trust in my doctor. And I go, you know what? Here's the list. Here's the list. Please take them to your doctor. And then I usually say, I want to be a fly on the wall whenever you have this conversation with your doctor, and show him this list of now 10 different lab tests. Because at that point, the conversation usually turns sour. You're not greeted with a big hug and a kiss saying, look how wonderful you came up with all these lab tests. That's beautiful that you did that investigation. I don't think that's the kind of response that I've heard, at least, occurs. I will say, for those of you who have a mind to still want to do it, I say you need to arm yourself. Arm yourself with a book. I've mentioned the book many times before. It's the one written by Jimmy Roberts and Dr. Stephen Sinatra, entitled Reversing Heart Disease Now, because if you at least walk in with this book and plop it down on the desk as you have the discussion with that doctor of yours, at least he's going to know that this isn't something that you came across in a surreptitious way. No, you read a book, and doggone it, in that book it mentions that these tests, every one of which, except for the last 2, all the initial 8 blood tests are in the book. The 2 newest ones are not, because they weren't even known when the book was written and published. And at least 8 of the 10 are, and I strongly recommend Reverse Heart Disease Now for you. It should be in your personal library, and if you're going to go walk into a doctor's office and say, could you please order me these 10 lab tests, you better be armed with that book, or please record that conversation. I'd love to hear about it with you. Come to my office, and we'll get them more. Okay, that's enough of the preliminary stuff out of the way. Here we go. Here comes the list. Are you ready to write the list of number 1, the number 1 lab test that you want to get? And by the way, it is the only one that your doctors do order, is the lipid panel. Lipid panel, number 1. And it's comprised usually of 4 different parameters. There's cholesterol, there's triglyceride, there's HDL, and there's LDL. And I want to tell you, you know by going to your doctors, if you go there with any frequency, this is the standard blood test that's always ordered. It's ordered so much that I can stop people in a checkout line at Giant Eagle and just impromptu style ask them, what is your cholesterol level? And they can tell me. They know it. They wear it with a badge of honor. They know what their cholesterol levels are. Now, this happens to be the one that gets ordered because, and I may disagree with how the medical profession has handled this particular parameter, but because the statin drugs have been now available for coming up 30 years, okay? 30 years ago, statin drugs hit the market. It turned into be an unholy matrimony between the pharmaceutical industry and the medical profession, but that's neither here nor there, because the doctor actually has a medicine, a prescription medicine to allow him to change these numbers. And I don't like how he's changed them. I don't like how he's numbered them. But nonetheless, because he has a tool in his toolbox to do something about them, he will run you around the office and chase you and tackle you and make you take these medicines because he really feels that the sun rises and sets on your cholesterol level. You know how bad they've done a job on this one. They completely changed the number. The original statistic, if you check any medical books of the genre around 1980, 1970, you find out the normal cholesterol level is, not was, it is 250 to 300 milligrams percent. The medical profession said, oh no, we don't like that at all. I don't know why they said it. I don't know how they could have the nerve to say it, just change it. But they changed it to 200. And it's gone way beyond that now because I see patients who come in here with cholesterol levels of 160, 150, 140. They think they're doing wonderful. Their doctor's patting them on the back saying, great job. And this is a dangerously low level of cholesterol, a substance you must have. Anyway, cholesterol in extreme high amounts is a problem. I just rarely, and I mean only rarely, find that it is ever in that level, that it is one of the factors that can lead to irritation and inflammation of the lining of arteries is true. But let me just say this, that if it would be true that your cholesterol levels are high, and that they're so high, they're above 300 milligrams percent, they're 350, they're 400. I've had them have this high, and I tell you, truthfully, 1,500 cholesterol level with various patients that I've seen. What I've learned, and especially by that person with the 1,500, is that there are other non-pharmaceutical ways to lower this. Please come in so we can talk about them, but there absolutely is a better way than using a statin drug, which I think is, well, it's been a blemish on the medical profession on how they've fashioned to use statin drugs. Of course, with the triglycerides, this is a measure of how your carbohydrate intolerance has then. And of course, triglycerides should be around half of what the cholesterol readings are whenever they're severely elevated. This means that you have in carbohydrate intolerance, you don't metabolize them well, and what is on the carbohydrate pile at the end of the day, overnight, turns into triglyceride. The carb turns into a fat, and that fat has an injurious component to the lining of arteries and will also inflame. Now this thing called HDL, supposedly the good cholesterol, and LDL being the bad cholesterol, I want to get away from using LDL in the context that it's bad. It is not bad. It's injurious if it oxidizes, but as long as you can prevent its oxidation, it's extremely important to have LDL as well as HDL. And yet the medical profession will try to lower LDL, a substance you must have. The only thing you need to do with LDL is make sure it does not oxidize, and you do so by the use of antioxidants. And so now I hope that we put in context this number one played card by the conventional medical community. The cholesterol issue has been way overplayed. The cholesterol era has been a complete and abject failure. Cholesterols have been disturbed in a detrimental and harmful way to the human body, all based on that unholy matrimony between the medical and pharmaceutical industries. And it still goes on, but the public has had enough. They themselves have now rebelled. They don't want any part of statin drugs anymore. The doctors are beside themselves. They're yelling at patients, you got to take them. The patients say, I don't want to take them. It's a line of contention. Let's just say, rarely is it they needed, but if they were to be needed, there are other ways, much better ways, non-harmful ways to be able to lower cholesterol if that, in fact, is the case. Test number one, put us up. Number two, let's take homocysteine. I actually see a couple of doctors even order it. Very unique to see that done. But homocysteine is another inflammation risk factor. If the homocysteine levels rise, it is caustic to the lining of arteries. It damages the lining of arteries. You must lower your homocysteine level. Homocysteine is one of the byproducts of methionine metabolism, which is an amino acid. And as it's metabolized, it changes from one form to another, and a brief amount of time during the metabolism of the methionine, it exists in the form of homocysteine, but then your body should handle that and move it into the next product down the metabolic chain. In some patients, and those patients are about 50% of the population who have an MTHFR gene defect, they can't methylate, and consequently levels of homocysteine rise. You need to be able to detect it, and you need to be able to put out that fire. And there may not be a medicine for it, but there sure is a combination of B12, B6, and folic acid that'll put out that fire. We'd like to see homocysteine levels below 10. And in the medical literature and the labs, when I do them on patients, it comes back and has 15 up to 15 normal, and that is incorrect. It must be below 10. Next, number 3, HSCRP. HS, heart-specific C-reactive protein, number 3 on the list. This is a measurement, an interesting measurement that allows us to determine inflammation in the system. It sort of acts like a thermometer. As CRP rises, the heat and the flame has increased within the arterial system. And you need to put out what the cause of the flame is in order to have the CRP descent. Normal CRP levels, HS, standing for heart-specific CRP, heart-specific C-reactive protein, should be in the decimal point ranges. And as long as it is in those ranges, it means there's very little to no fires at all, no matter what any other blood test may happen to indicate. If CRPs are high, you then have to go find out what could be that which made them high. Is it an elevated LDL to 300? Is it a homocysteine off the wall? In which case, by correcting either one of those two, to normal levels, the CRP would then descend. It is your thermometer, folks. HS, CRP, an absolute must of the list of 10 and should be included in every one of your lab tests, and it is not, and you need to demand that it is. Number 4, ferritin level. Ferritin level is tissue iron. And iron is very caustic to the lining of arteries. In productive females, meaning premenopausal females, they always are found with very low ferritin levels and hemoglobin and hematocrit levels that border either on anemia or the woman is frankly anemic because menstruation and monthly loss of blood diminishes the red blood cells and diminishes the iron level, so that premenopausal females never have a problem with ferritin. They're always in the 30 and 40 ranges. The normal should be around 100. But men, you do not menstruate. You do hang on to ferritin. It is caustic to the lining of arteries, and in the men in particular, in the younger age groups, and once menopause comes around, women also too have this buildup of ferritin, this caustic substance that needs to be lowered. You lower it by donating blood, either the noble way, going to the blood bank, or right here in the office where we remove small quantities of blood and just pitch them. Your ferritin level would descend as a result of it, and the fire, the ferritin fire, would be put out. The inflammation would stop. Number 5, lipoprotein little a. It's another form of cholesterol, folks. Lipoprotein little a is really sticky, and because of it, it is the worst of the forms of cholesterol that form a sticky substance that accumulates the cholesterol-laden products within the lining of arteries. Lipoprotein little a is a genetic issue. There are 40% of the population out there that has a lipoprotein little a issue. You never have it tested, so what would you know? Your doctors aren't letting you know. And if you have a lipoprotein little a problem, you absolutely need to do something about it. There is no medicine for it, so consequently, that's why you're not getting the testing done. The lipoprotein little a level needs to be below the number 30. And if you're approaching 30, if you're over 30, you must be able to put out that fire in a special way. Once again, no medicine exists to do it, but a combination of lysine, proline, and ascorbic acid, which is vitamin C, absolutely will. And it would be my suggestion that you at least determine if your lipoprotein little a is off or not. If it comes back normal, you will never have a problem with lipoprotein little a because genetically you won't have the makeup to ever have that become an issue. But if you do have this come back as an elevation of 30 or above, then what it is saying is you're one of the 40%, and you always will have this parameter to deal with, and the need for lysine, proline, and ascorbate will remain a fixed component of your supplementation well into the future because there is no medicine to handle it, but those 3 will. Next, I put this in here next. It's the new one. It was the number 9 that I told you about when it first became available. It's appropriately placed here because it's one of the chemicals that fly around the body. This is the LDL particle size. About 1.5 to 2 years available now. This LDL particle size is extremely important for someone to know. And the reason is that LDL, which you absolutely have had measured thousands of times when you get your cholesterol panel done, LDL comes in 5 flavors. Really big, big, not so big, medium, and small. And it's the small component, the small LDL particle, that is the most problematic and injurious. It's so small that it actually can fit down within the cracks of the lining of a cell membrane, and should that substance oxidize while in that crack, you've got major membrane destruction issues that are occurring. You must deal with the LDL particle size, but you can't change your genetic proclivity to hold on to small LDL. So what do? In that case, you must bring on a large supply of antioxidants. I can tell you that I've had patients with LDLs. We look at their the level of LDL, and it's maybe, let's say, 60 or 70. And they say the normal LDLs go up to 99. What if they're 99? And so the doctors would look at that and say, well, look, that's normal. Yet, in someone with a normal LDL, once you do the LDL particle size, they could have a completely abnormally skewed amount of the small LDL and be really chewing up the membrane because of the damage that it can cause. Thinking that everything was okay, they would walk down the street thinking, well, I don't have to do a thing. I just got my blood test back from my doctor and everything's fine. Well, it's not fine if the LDL particle size, the small one at least, is out of whack, is out of line. And from that perspective, if you need to know about it to know if you are such a person. This has been a wonderful thing to be able to help people with in order to put out that fire. This would be a major fire that you would not be aware of in any way by getting an LDL test from your doctor, which you do, because he never asked for the LDL particle size. You must demand it. Now, those are the chemical properties of blood. There are 3 different blood tests I also get which point to other causes other than chemicals. And the number 7 slot is chlamydia. Is that 7? 1, 2, 3, 4, 5. Yes, chlamydia titer. Bugs, in particular, chlamydia pneumoniae is a bug, a bacteria that loves the lining of the heart and blood vessels. This is not the sexually transmitted form of chlamydia. That's another form. I'm talking about chlamydia pneumoniae. You could have had a bad cold, you thought. You could have had a pneumonia, some upper respiratory infection. But once this organism gains a foothold within the arterial system, it is problematic. It absolutely needs to be extinguished. And so you ask for a chlamydia titer to find out whether or not those bugs exist. And if they do, you would use an antimicrobial approach, whether that be pharmaceutical or not, in order to eradicate it. If the test is never asked for, you can never put out that fire. Ask for it, demand it, to know if you have the fire, and then it's pretty easily to extinguish that fire once that is known. 2 other lab tests, which are in the 8 and the 9 position, are the interleukins. If all other blood work comes back okay or normal, but the CRP remains high, meaning we have inflammation in the system, the only conclusion left at that point is to consider that it's the patient's own immune system that's in play. And you would find the interleukins 1 and interleukin 6, the numbers 8 and 9 on the list, to be out of the amount and levels that they would be normally, which would point to an immune system issue, an immune system that would have to be shut off because it's attacking your arteries in your particular case. And that fire can only be extinguished by looking to the immune system itself to put the fire out. It's up to the number 9 on the list. Let's come in with number 10. This is the brand newest member of the list. It is something I only found out about in the last 2 months because I think medical science is just revealing it as such in the last 2 months. This is something I mentioned when I first found out about it. I brought it to your attention. I now put it as a number 10 player on my list of 10. Remember, the list used to be 8. And this is a substance that is measurable called TMA or TMAO. It stands for trans-methylamine oxide, TMAO, and it is a urine test, not a blood test. And it is done in only one laboratory in the entire United States. By the way, I understand it used to be done in a lot of labs, but because nobody asked for it, They didn't know that. They asked. They didn't even understand that it was possible to find out. But because it was never asked for, all labs quit doing them, and it's moved to only one lab. By the way, that is the case as labs go. If it turns out that a lab is very infrequently requested by the medical profession, then they usually have one site that everybody in the lab world uses to ask for the test, unless that one site run all the tests. It takes additional time to get it back. In the case of TMAO, it takes about 3 weeks to get it back. The name of the laboratory, I'm just going to let you know, is UCD Biochemical Genetics Lab. It's found in Aurora, Colorado, but the test is available. TMAO is coming from the gut. Interesting thing that the gut is playing a role in cardiovascular disease by having abnormal bacterial flora in the gut, literally forming TMAO, and TMAO gaining entrance into the bloodstream, being absorbed into the bloodstream and wreaking havoc once in the bloodstream by causing major destruction, inflammation, and damage to the lining of arteries. You had to figure at some point the gut could play a role, but now to know that it does and can play a role, and it is on the list of 10, it's very comforting for me to know that we are not going to miss it, and we'll be able to test you for it. Bongos in the background. I hope you enjoyed the list of 10. First time I've done this one. Like I said, in 2 years, now the list is up to 10. Be talking to you on Wednesday about there's only one way to get cancer, and there's only one way to stop it. I hope I have your attention. I'll see you on Wednesday. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on your health.